Hello, everybody. My name is Moscoso, and I'm here to speak about my research this year. My research proposal focused on appointment access for low income patients that are seen by resident physicians. Since New York Presbyterian is a teaching hospital, primary care services are delivered by resident physicians and attending physicians. While continuity of care is not an issue for patients that are seen by attending physicians, patients seen by resident physicians face a dearth of future appointments availability. These unsatisfied patients often end up not receiving the needed care or end up going to look for services elsewhere. I researched best practices on ensuring continuity of care with resident physicians. I did a literature review to see how other institutions have addressed similar challenges and whether their efforts to ensure continuity of care have been successful. The purpose of the research is to help promote continuity of care by having appointments available for patients with the same resident physician when needed. Some of the benefits of continuity of care include preventive services, improving clinical outcomes in chronic disease, establishing patient trust and satisfaction, and ensuring economic efficiencies. While conducting my research this year, I found out that some of the reasons for non-continuity of care with resident physicians are: first, residency programs in a hospital struggle to balance patient care, staffing, and educational priorities while complying with duty hour regulations of maximum 80 hours per week. Second, the Accreditation Council for Graduate Medical Education only calls for ambulatory experience to comprise 33% of internal medicine training. Even though most of the healthcare in the United States occurs in the ambulatory setting, yet the focus of most internal medicine graduate medical education remains inpatient based. This historical bias towards the inpatient setting has caused many internal medicine residents to view their ambulatory experience as a lower priority than inpatient medicine. While conducting the research this year, I learned that residents training at ambulatory clinics should be incremented due to ambulatory care being our primary health deliverer. I think residents should spend 50% of their time training at ambulatory clinics. With that being said, I also learned that there are ways to increase continuity of care with resident physicians. The example used in one of the articles was that we can switch to a 4+1 block schedule, meaning that the first 4 weeks of the month, the resident spent it at a inpatient, and 1 week for 5 days for the whole day, the resident will spend it seeing patients in the outpatient clinic. The results were that the sessions per intern increased. The 15 traditional schedule residents had an average of 17 sessions for the first 5 months and completed 525 visits. The residents following a 4+1 scheduling guidelines had an average of 22.5 clinic sessions for the first 5 months and completed 1,174 visits. As we can see, efficient scheduling not only creates more available appointments for patients, it also gives us a chance to see more patients and provide the care needed. Thank you.